Hello, hello everyone. I'm just gonna pin the comment real quick, so apologies if I'm a little quiet. Hi, Lisa. Thanks so much for joining us. We are going to be going live today about Whitman-Walker's mobile health initiative. I'm going to wait for my colleague Marshun to join us. So just give us 1 second. We'll get started momentarily. Okay, cool. I have the comment below, and I pinned it now. Welcome, everyone. Just want to wait for my colleague Marshun to join us, and we'll be talking again about Whitman-Walker's mobile health initiative. And if you don't know what that means, you will know very soon. Just wait a moment. Feel free to put how you're doing on this Friday in the chat. Would love to hear from you. I am loving how my air conditioning's working because I felt how hot it was this morning. Let me just check on Marshun to see where he is. Just wait 1 minute. I texted Marshun, so hopefully he'll be coming in pretty soon to talk with us. No filter, thank you for joining. And there he is now.
Sorry about that, Brandon. It wouldn't let me click add.
Oh my god, no worries. Thank you so much for joining us, though.
Thank you. How are you?
I'm doing well. My room was really hot this past week, and then I think my air conditioning wasn't working, and it just got fixed, so now it's nice and cool in here. I'm loving my work from home life now. How are you?
I'm doing well. It feels great in my apartment. I'm having some issues with my hot water tank, but hopefully they'll pull up on me and get that resolved soon.
I'm so sorry about that. Okay, yes. Hopefully resolved.
Yes.
I think we can get started if you want.
Yeah, absolutely. Well, everyone, it's of course Marshun, the Whitman-Walker Live OG. I work here at Community Health, and I'm joined today with my fave coworker, Brendan, and I'll allow Brendan to introduce himself.
Hey, what's up? It is your other OG Whitman-Walker Instagram Live fan star, Brendan. I'm the community outreach specialist with Marshun at Whitman-Walker. My pronouns are he, him.
Yes, so as you guys know, let me clear this. Whoa, it's like all of this stuff coming up. Anyways, so as you guys know, during the past few months, Whitman Walker Health's community health department team has expanded its outreach efforts to the social media platform. We cover various topics about HIV and STI sexual health practices, access to care, social determinants of health, and general public health interventions. Our series of outreach sessions also focus on the current pandemic, COVID-19, and ways you can support your sexual, personal, and mental health. The Whitman-Walker Community Health Team is here to educate and support you.
Period. So today we're going to be talking about Whitman-Walker's mobile health initiative, and I'm just going to go ahead ask Marshun a bunch of questions about it so that you guys know how to access our services, what those services are, how you best can use what we're giving you.
Okie dokie.
So Marshun, can you tell me what is the mobile health initiative?
So the Mobile Health Initiative is my baby, one. And just to give you some background around it, we offer a lot of services at Whitman-Walker Health. We have clinics in Northwest and Southeast DC. We offer HIV STI testing, so that's HIV, syphilis, gonorrhea, and chlamydia testing. We offer primary care, legal services, anything under the sun you can name, insurance navigation, all of that. But getting to the clinic can pose a barrier for most people seeking support, especially during COVID-19. So, transportation can be an issue for a lot of people. That's why we created the Mobile Health Initiative, or MHI for short. The MHI is a mobile health clinic that travels in various wards in DC wards 5 through 8, and we're committed to expanding access to care so we can truly serve everyone in DC and improve their health.
That's a really amazing idea. You mentioned that Whitman-Walker offers a lot of services in its main office in Northwest and Southeast DC. What kind of services does the MHI offer?
So MHI provides a wide range of services to people ages 16 and older. First, we offer free and confidential instant HIV rapid antibody testing. So that's going to be a finger prick test. It's a blood test. You get your results in about a minute, and it has very high accuracy. Then from there, we perform a free and confidential STI testing through a STI self-kit test, which consists of a blood draw for your syphilis test, a urine sample, and a self-collection throat and rectal swab for chlamydia and gonorrhea. We also offer a 4th generation HIV test through our MHI department. So if anyone is ever interested in a 4th generation test, they can definitely pull up on the Mobile Health Initiative team. And if someone discloses that they've been exposed to HIV while we're out doing outreach, we have within 72 hours to get them into PEP or 3 days. And we can connect them to our main clinic for that service. We also sometimes have a medical provider present where they can start PrEP if they're interested. And PrEP is pre-exposure prophylaxis. It's a once-a-day daily medication that dramatically reduces your risk of contracting HIV. We can also connect you with pretty much any other additional service that we offer here at Whitman-Walker, any service you can think of. For example, if we're out doing outreach in the community and you're trying to get your COVID-19 vaccine, we can definitely schedule an appointment for you at any one of our locations that I mentioned earlier, Southeast or Northwest. And if you're hoping to talk to someone about insurance, we have insurance navigators that we can connect you with as well.
That is so awesome that you guys are just going around DC, bringing your services with you, but also connecting the services that aren't there. That's incredible. So I just want to reiterate, you can get free HIV testing, counseling, access to PEP and PrEP, and pretty much any other service. Is that correct?
You hit it right on the nail. Our goal is to pretty much lower barriers in healthcare and make it easy for people in the different wards because we know that wards 5 through 8 are medically underserved committees to access our services. So that's why we're offering so much, and we're specifically in those designated wards.
Cool. Do I have to make an appointment for MHI? Do you do walk-ins?
So, all right. HIV STI testing services are free, so you don't need to worry about insurance, but you would need to schedule an appointment. You can call the number that we have pinned below, and we can gladly schedule at our Southeast office, or if you're more accessible to our Northwest office, we can definitely schedule you at that office as well.
And so you said the tests are free. Do I need to worry about insurance at all for any of the MHI services?
No, absolutely not. Everything is free. Testing, treatment will be free as well if any of your results come back positive. Just because, like I said, we know that that's a barrier when it comes to a lot of people wanting to get tested, insurance. And also, if they're interested in PEP and PrEP, we can talk about insurance with our insurance navigators. There are a number of patient assistance programs that we can enroll you into to help pay for those prescriptions. And if you're hoping to get insurance while at an MHI event, we can definitely connect you with an insurance navigator too.
That's super cool.
And I feel like we should cruise through the comments because I feel like a lot of comments are popping up. What is the schedule for MHI? That's a great question. So the schedule for MHI is very flexible. If you need us to come out to an event and perform outreach, we can definitely pull up on you at the designated time. But generally, we are located every Wednesday, each and every Wednesday, at our Southeast office, Max Robinson Center, from 9 to 4. So if you're needing testing, treatment for any STIs, if you have any known exposures, if you're interested in PEP, if you're interested in PrEP, we can gladly serve you. Serve you every Wednesday.
Yeah, and if you are in this live right now and you're in a community organization in wards 5 through 8, if you know of like any event that we would be really good at, please just DM us right now. You can reach out to us individually. You can call Whitman-Walker. Get in contact with us. We want to be out in the community. We want to be going to events. So just let us know, like, we want to bring our services to you. So please let us know how we can do that.
Yes, and MHI, I see the comment, is MHI just for meals or everyone? MHI services are for everyone. Anyone who's interested in testing, regardless of your insurance status, you're eligible to receive our free service.
Yeah, I mean, the things that we're testing for, like HIV, chlamydia, gonorrhea, syphilis, they affect everyone, no matter your race, no matter your gender. So we want to make sure anyone who wants to get our services can get them.
Absolutely.
Last thing I'll ask is how long does it take for results to come back? Like if I get tested on Monday, like when should I expect to get my results back if I'm doing MHI?
So, when you come in, you'll receive a rapid NC HIV test that I mentioned earlier, the finger prick test. Those results come back immediately. And for your STI testing results, you'll receive them within 7 days. If you test positive, we'll connect you with treatment at our GMHC clinic. So no worries, and treatment is free as well.
Yeah, that's great that, you know, Whitman-Walker is there to connect you every step of the way. So if you test positive,
Absolutely.
they got you for treatment. It's free. Don't even worry about it. They're going to reach out to you. They'll do everything that you need.
And then if a test comes back positive, what is my next step after MHI? So, here at Whitman-Walker, we have a patient portal, and we give you a results card when you receive your testing, so we can enable you for our patient portal. And we also give you like a business card, like size results card, where you can call the number on the back and get your results. If your results were to come back positive, we will contact you automatically, so no need to worry about receiving a call from us. We offer treatment Wednesdays at our Southeast office and Tuesdays and Thursdays at our Northwest office. So your next step would just be you coming in for your treatment appointment, completing your regimen, and yeah, that's pretty much it. And treatment is, like I said, free as well.
Are there any more questions? Thank you for sharing all that information, Marshun. That's super helpful to know. I really hope that people in the comments not only decide to come, but also reach out to us, let us know what kind of events we can go to, what kind of things we can do in the community.
Right, and if you don't feel comfortable asking your question in the comments, you can definitely DM us. You can give us a call at the number we have, any number we have pinned below. You can call that number. just because we know that it's a pretty open space and not everyone may feel comfortable asking questions in the comments.
Well, is there anything else you want to share about MHI, Marshun, or do you think we've kind of covered it so far?
No, other than MHI being my little baby, no, I'm so happy to be a part of the Mobile Health Initiative team. Just because, like we mentioned earlier, transportation is a huge issue. I don't even have a car here. So I understand people wanting to get tested and just not knowing where to either go or just not having the capacity to, pull up to any of one of our sites. So I really enjoy us going out in the community and actually meeting people where they are.
Oh, totally. I think, Marshun, you started doing MHI in like October of 2019, right?
Yes. Well, November 4th, 2019.
Okay, you remember the day.
Yes.
So Marshun's been doing this for like almost 2 years now. I am just transitioning onto the MHI team, so this is really good information for me to get to hear as well. And we hope
Yes.
community sometime. So look out for us. Let us know what we can do for you.
And everyone, welcome Brandon onto the MHI team as well.
Thank you. So
Yes.
if there aren't any more questions, I'll just say before we go, we want to give you a few reminders about COVID-19 and its vaccines.
Okie dokie. Um, excuse me. If you've already gotten vaccinated, congratulations, everyone. You've taken a really important step in preventing yourself, your loved ones, and your community from illness. The Delta variant is soaring across the United States, as we know at the moment. So it's totally understandable why you might want to keep wearing your mask. The vaccine isn't 100% effective. It's more contagious variants are spreading around. So there are a few protocols in place to actually verify that folks around you are vaccinated. So keep on staying alert.
If you haven't yet been vaccinated and you're looking for an appointment, Whitman-Walker Health has COVID-19 vaccine appointments available. Everyone ages 12 and up can receive the Pfizer COVID vaccine, and everyone ages 16 and up is eligible to receive the Moderna COVID-19 vaccine. So please reach out to us and we can make that appointment for you. Or if you feel comfortable going somewhere else, we can facilitate an appointment to another center for you. The number is below. It's 202-207-2480. And DC residents, if you're having trouble making an appointment with us, you can find information on the DC website. You can also find their phone numbers there. Maryland residents, you can go to that Maryland website and find phone numbers there, where there's also like a vaccination portal if you live in Prince George's County or Montgomery County. And for Virginia residents, there's just a website that has the phone number you can call to make appointments.
Absolutely. And I see someone say, please wear your mask over your nose and mouth. Absolutely. Please wear your mask over your nose and mouth, you guys. And if you haven't been vaccinated and you're looking for an appointment, please continue to follow the CDC guidelines for wearing masks, quarantining, social distancing yourself, and most importantly, washing your hands. It's very important that you get the vaccine, discuss your vaccine precautionary measures with those around you, and be mindful of masks and keep your distance from others, especially when you don't know if the other person is vaccinated or not.
If you want to support Whitman-Walker, either related or separate to the COVID-19 vaccines, I just want to put in a plug that you should register to walk, run, and donate at this year's virtual walk and 5K to end HIV on Saturday, October 23rd. We have been doing this walk for so many years. This year's a very special year because it's our 35th anniversary. So register yourself or a team today at walktoendhiv.org.
And everyone, remember to follow us on IG, Facebook, and Twitter at Whitman-Walker, and checking our website out at www.whitman-walker.org for the most up-to-date information on our services and for more COVID-19 resources and general Whitman-Walker services. Please call us at 202-797-4439 if you have any questions. And follow also some of our other programs in Whitman-Walker family at Real Talk DC _ and at No Filter DC and at The Corner DC.
a lot of plugs. I think someone asked, how far do I have to run to make a difference? The walk is all about the community. It's all about getting together, which we can't do as much in person now, which is why it's a virtual walk. So, I mean, like, technically it's a 5K, but if you just want to donate, that will also
Yeah.
there are many different ways that you can show support for Whitman-Walker other than running.
Absolutely. Brendan is our 5K runner, so I'm pretty sure you'll be running the entire 5K, Brendan. So you're the perfect person to answer that question.
Marshun, you were a runner too, okay?
That was true, and a walker at the same time. Well, I really enjoyed this, Brendan, and I will see you. I won't see you tomorrow, but I'll see you sometime next week. And thanks for having me. And if anyone has any questions, feel free to DM us. We have our phone number pinned in the comments. And yeah, shout out to MHI.
Shout out MHI. Thanks so much for joining, everyone. It was so awesome to talk to you, Marshun. I'll see everyone soon.
Bye.
Bye.